Hello, my name is Dr. Gregory Doerr, and today I'm going to talk to you about a class I developed called Functional Taping for Musculoskeletal Injuries, FTMI for short. FTMI is a taping class associated with almost all the existing modern techniques that are available to us. We're going to use in kinesiology taping, we're going to use SPRT taping, or Tim Brown's specific proprioceptive response taping. We'll bring in McConnell taping, Mulligan taping, and we're going to use all of these different taping techniques associated with the different body parts. We're going to talk about some of the theory behind things like kinesiotape, rock tape, and a bunch of the other spider tech pre-cuts, and utilize all of that information to give us a very concise and important aspects as to why we're going to be applying kinesiology tape. We're also going to create algorithms associated with which technique is appropriate depending on what shows up on our pre-evaluation testing. Now, this is the actual unique thing about FTMI. Taping techniques, yes, there's several unique ones that I'll show within my classes, but going to each of the different certification classes, you can learn kinesiotape, you can learn rock tape, you can learn McConnell taping, you can learn Mulligan taping, you can learn SPRT. However, what we're going to utilize in this 1 12-hour class is all those different techniques that are out there, and most importantly, create the algorithms, that pre-testing evaluation that's going to help us determine which way we need to go, which technique is going to be utilized. And most importantly, we're actually going to find out, based on our pre-testing, whether taping is even appropriate for this patient. One of the things that always frustrated me when I took my classes, and I've taken almost all the modern taping techniques that are out there now, is I learned how to tape everything on the body, but I never learned why, and I never learned when it wasn't appropriate to tape. So within the FTMI class, we're going to go through those pre-testing evaluations that not only is going to tell you exactly which technique is going to be useful and successful, but also when it will not be successful, when maybe something like more of a rehab or soft tissue might be more appropriate for this patient. So with the FTMI, once again, we're going to go through the use of kinesiology tape, leukotape, coverall, pre-cuts when we have them available to us, and most importantly, go through all the pre-testing to determine which of those tapes is going to be most appropriate and knowing we're going to be successful. We'll end the class associated with documentation and coding. The important thing associated about this, especially in our third-party payer system in the day of post-payment audits, is we want to make sure that we're coding as well as documenting appropriately, so nobody can ever come back and say we shouldn't have taped that patient on that particular treatment. And in this class, you're going to get the macros associated with the perfect note associated with each taping technique, knowing that you've demonstrated a reason why the tape was applied, as well as the medical necessity associated with that particular taping technique. I look forward to seeing you in an FTMI class soon.